A warm welcome to today's talk, Thursday the 18th of November. Now, we are going to be looking at the deteriorating situation in Europe, but I want to start off with a really important announcement from the UK authorities on vaccinating our young people. Now, on this channel, we've been going on about it for ages, about increasing the time between vaccines and increasing the time between when someone has an acute infection, when they actually have the COVID infection, as to when they get vaccinated after that. We've been advocating for a longer gap between acute infection and vaccine. Well, thankfully, this has finally been listened to. And it's culminated in this really important announcement here from the UK Health Security Agency, which was Public Health England. I just don't like the idea of calling it a health security agency, but nevertheless. Clinical guidance on vaccines for 12 to 17-year-olds. So basically what this is doing is it's increasing the gap if they've had acute infection to the time when they would be vaccinated. So following a review of the evidence by the Joint Committee on Vaccination and Immunisation, advice on the second dose for younger people aged 16 to 17 was issued earlier this week, and this has now been extended to include 12 to 17-year-olds. And why they didn't do that straight away, I have really no idea. And it says the second vaccine dose should be given 12 weeks or more following the first vaccine dose, or 12 weeks following a positive COVID-19 test result, whichever is the latter. Now, this is just pure common sense, because if you've just had the infection, you're going to have lots of antibodies to the infection, and then when you give the vaccine, that introduces the antigen to the antigen that the immune system recognises as being foreign, that mimics the virus, and you're bound to get a bust up between the two. The newly formed antibodies from the infection are bound to attack the newly formed antigens from the vaccine and cause an inflammatory reaction. It's obvious, and I'm just glad to say that they finally seem to have realised this and are extending the gap. So this is now official UK government policy at long last, which of course we are delighted to accept. Children who've had the COVID vaccine should wait 3 months to get who've had the COVID infection should wait 3 months to get the vaccine. Is 3 months enough? Personally, I would have preferred a bit longer, but this is what is now the official guidance. And direct quotes here, they say this is based on the emerging evidence from the UK and other countries. Now, I don't know about emerging, but we've known about it for quite a long time on this channel, so yes, okay, they've said it's emerging. And of course, what we have on this channel is just what's in the public domain. It's nothing spectacular. It's just looking through the public domain information and working out a bit of basic science on top of that. Anyway, which suggests that leaving a longer interval between infection and vaccination may further reduce the already small risk of myocarditis in younger age groups. As we've said now, 12 to 17. Now, looking at this, what I would expect now is a quantification. What is this risk? How big is this risk? Give me the numbers, then I can decide if I want to take that risk or not. Make me informed. So how are we informed? Well, this spokesman said, well, it's COVID vaccines are safe. There's no numbers here. There's no numbers here. We want numbers so we can make assessments for ourselves. Head of Immunisation says the COVID vaccines are very safe. Well, what does very mean? How safe is very? Based on a highly precautionary approach, we're advising a longer time interval between COVID injections and vaccinations for those aged under 18. So this increase is based on the latest reports from the UK and other countries, which suggest that leaving a longer time interval between infections and vaccinations will further reduce the already very small, well, how small is very small, of myocarditis and indeed pericarditis in the younger age group. I must say, reading this, I do feel somewhat patronised, to be quite honest. I want the figures to decide for myself, but there we go. We get these descriptive terms, very small, extreme caution, things like that. Not very satisfying for someone who likes a quantitative analysis. Now, if younger people experience any of the following symptoms after receiving their vaccine, they should call 111 or see their GP. Now, seeing a GP in the UK is not always completely straightforward, as we know from recent experiences. Think of Nick, for example. that we've talked to recently. Anyway, this is what to look out for that could indicate heart inflammation. It's important to recognise this. And of course, these are the same wherever you live. Pain and or tightness in the chest, which may spread across the body. So pain or a tight feeling, a heavy feeling, a tight feeling. Pain in the neck that may spread across the shoulders and or arms. This is what we call referred pain. So this is classic. When people have pain from the myocardium, their myocardial pain, very often they complain of pain in their left fingers, pain going down their left arm, pain going to the left side of the chest, pain going down into the epigastric area, pain going up into the neck, even into the lower jaw, as well as central chest pain. This is common. It's called referred pain, and well known to all people who work in cardiac departments or emergency departments. So this kind of referred pain idea. Shortness of breath when lightly exercising or walking. Okay, shortness of breath would indicate that the heart is not working properly. Difficulty breathing when resting or feeling lightheaded. So difficulty breathing when feeling lightheaded would tend to suggest either the lungs or the heart is not working properly, and feeling lightheaded when you're resting would be a potential sign of low blood pressure, which of course is not good. Flu-like symptoms such as high temperature, tiredness and fatigue, palpitations or abnormal heart rhythm, feeling like you need to be sick. Well, the way I've been trained and the way I've lived for the past 40 years and the way I've worked for the past 40 years, any heart conditions, we take them straight to A&E and hopefully straight to a coronary care unit to be monitored. New palpitations is basically a situation that requires, in my view, emergency assessment. Anything that indicates cardiac is an emergency assessment. So cardiac pain, emergency assessment straight away. New abnormal heart rhythm, again, this is an emergency assessment. I would want to assess these people in a full hospital clinical environment straight away. But let's just reiterate the advice. If younger people experience any of the following symptoms after receiving their vaccination, they should call 111 or see their GP. So perhaps a little less than satisfactory there, but better late than never that this change has now been recognised. There's the symptoms there, and that is it. That's all we get. That is the totality of the information. Hopefully quantitative figures to come tomorrow, but it may be a bit longer than that. So pleased to see that that time gap. And of course, if anyone does get any of these clinical features that we've mentioned, take complete rest until a cardiologist tells you otherwise would also be my advice. Now, my mistake yesterday. Apologies, thanks to Charles and many others. I tell you what, I am seriously well peer reviewed. It's great. It's great. I don't get away with getting anything wrong or confused or well, I'm being kind to myself saying confused yesterday. I got it wrong basically. Let me show you what I got wrong. Now the confusion was between vitamin K1 and vitamin K2. So we looked at this information here. And it just says vitamin K. This is the NHS site here. It just says vitamin K. But really, this is talking about vitamin K1. That's the bit I was insufficiently intelligent to twig at the time. So this information here is basically about vitamin K1. So green leafy vegetables such as broccoli and spinach, vegetable oil, cereal grains, small amounts found in meat and dairy food. That's talking about vitamin K1. Which is good. This was discovered by German scientists for coagulopathy. We spell it with a C in English, but it's spelled with a K in German. So it's the coagulation vitamin, the vitamin K. But vitamin K2 was discovered afterwards. Now there are chemical relationships between vitamin K1 and vitamin K2. But really, in people like me at least, it causes all sorts of confusion. It might have been better to call it a different name rather than K2. But anyway, here we have vitamin K2. And we noticed yesterday that the advice from the paper we looked at yesterday was that if someone's on high doses of vitamin D, it would be a good idea to take some vitamin K2, because the vitamin K2, what it does is it puts the calcium in the right place. It's a calcium controlling vitamin. So you want the vitamin K2 will put the calcium into your bones and not the calcium into your arteries, where it can cause this disease called atherosclerosis. So this is vitamin K2. Now, vitamin K2, just to stress now, I think we've got it right, does not come from green leafy vegetables such as broccoli and spinach, vegetable oils or cereal grains. Where vitamin K2 actually comes from is essentially bacterial fermentation. It's a bacterial fermentation product. So this is actually made from a fermented food. It's refined from a fermented food, my particular K2, which I'm now taking. It's the bacterial fermentation products, and fermentation basically occurs in the presence of water and salt without much in the way of oxygen. And it also happens in the guts of animals. So if animals are fed on grass, whether it's sheep or cows or whatever it is, then the grass will be fermented by bacteria in the animal's intestine, and that will then be absorbed into their tissues. So grass-fed meat contains vitamin K2, but the easiest way to get it is to eat fermented vegetables. Now, of course, we don't eat fermented vegetables. If you go to Korea, they have kimchi with all meals, and this is made from some other fermented food. I can't even remember, some Japanese food. So China, Japan, Korea, they tend to eat fermented foods. Western countries, we tend not to. Now, it is changing. We are starting to eat more fermented foods now. So that's good. So we will get it from the diet. So it's fine for vegans. Just eat fermented cabbage, like sauerkraut. Only the stuff you get in jars is often pasteurized. You want the real sort of fermented stuff, I would have thought, to get the best amount of vitamin K2. So apologies. So we've got that. Vitamin K2 is not from those things. It's from fermented products. And if you think about it from our hunter-gatherers perspective, when humans were evolving out on the savannah or whatever it was, then all of the meat that they would be eaten then would be grass-fed, because there wasn't anything else. There was no artificial grains for the animals to eat. So all the meat would be grass-fed. So our hunter-gatherer ancestors, and of course we have to think of ourselves as hunter-gatherers, they will get plenty of vitamin K2 from grass-fed meat. And also it's reasonable to assume that some vegetable foods were stored for a period of time and probably would ferment, and therefore they would get vitamin K from fermented food. So it's quite consistent with us being hunter-gatherers. But there you go, vitamin K, which is the vitamin that's good for putting the calcium from the blood into the bones rather than from the blood into the tissues, is mostly from fermented bacterial products. That's why if you take a Western diet, like I'm afraid I do, I've been trying to put in kimchi and more Mediterranean diets, but it doesn't tend to work out very well. So that's why I take that supplement. If you eat kimchi for breakfast, lunch and dinner, as I've worked with Korean colleagues who do, no need for the vitamin K2 supplement. So mea culpa on that one, apologies, but I think that has corrected it. Now let's just look at some background information now to work out what's going on in Europe. Now, here we have new daily confirmed cases. Ireland, European country, of course, going quite high. United Kingdom, United States come down nicely. Canada, Australia, New Zealand, much better. And just checking on the hospitalisations there, these are the only countries where hospitalisation data was available amongst that group: United Kingdom, United States, Ireland and Canada. So United States and United Kingdom, in terms of hospitalisations, about equal now. But still at a reasonably high level. These are still causing quite a lot of problems in the UK, and I imagine it's the same in the States. We've just got so many delays, so millions of people waiting for procedures on the health service. It really is a problem. We really could do without any COVID cases at all to free up the beds to deal with this backlog. New daily confirmed cases per million. Now this is the European situation. Now basically we've got well, I suppose we've got 3 Europes here really, haven't we? Now I've left the United States on there just as a comparator. I do know it's not in Europe. So Spain, Italy, France, United States lowest, but France has actually gone up quite a bit lately. And what we have to look at here is the risk of doubling times. So France is still at risk. Germany, sharp increase lately. United Kingdom, Denmark, Greece in that group. The United Kingdom, levelish, going down slightly actually at the moment in the UK. For fact, it is going down in the UK. Denmark and Germany going up. Then higher numbers in Hungary, Ireland, Belgium and Netherlands. Look at that sharp increase there in Netherlands, very sharp increase. And then some of the smaller European countries with very high rates: Austria, Croatia and Slovenia. And if we look at the impact on hospitalisations, again, as we see, people under severe stress in Slovenia, Hungary, Croatia. Austria and Belgium becoming more difficult. UK, as we've just said, the United States, France, Ireland, Netherlands, Italy, Denmark, Spain. And in fact, patients have been transferred from Germany. 2 patients have been transferred from Germany to Italy for intensive care because Italy is under less pressure. Cases per million. Now, I keep getting bombarded with accusations of secrecy about Scandinavian countries. I don't know where it comes from, but never mind. Let's disprove it now. So I've left the United Kingdom in there for comparators. Denmark's going up. Norway increasing. I've left the United States in there for a comparator. Finland going up a bit. Sweden remaining really quite low, which of course is good news, because I think it's fairest to compare countries like Norway, Finland and Sweden with each other, because they've got similar climates, similar geographies. Makes more sense to compare them with each other. Similar low populations. But when we look at the testing, we see that Sweden isn't actually testing very much and haven't bothered, or the data's not there for the last few weeks. Then Finland, Norway, United States, testing's not brilliant. United Kingdom testing is good. Denmark, of course, leads the world with testing. And until recently, Denmark was doing genomic analysis on all of the positive tests it did. I don't think it can probably do that now because it's got a lot. But if we look at hospitalisation, so Sweden, hospitalisation is low, which is great. Norway, Finland, Denmark, much lower than the hospitalisations in the United Kingdom and the United States. So Scandinavian, northern countries, it has to be said, are doing really quite well there. Now let's just look at Europe a little bit more today. Germany. A lot of concern in Germany at the moment. Bavaria transferred 2 patients to ITUs in Italy. Now, to be fair, it's just across the Alps. You go through a couple of railway tunnels and you're there. So it's actually quite close. But the point is, Germany transferring intensive care patients out of the country really is quite a thing. Why? I suppose it's quicker than transferring to other parts of Germany. Now, ITU capacity in other parts of Germany is available, but the hospitals are filling up in Germany. Now, the World Health Organization has said there could be another 450,000 deaths in Europe. This is not Germany, this is in all of Europe, over this winter, basically, between now and February. So the situation is deteriorating despite high vaccination rates in Europe, I am afraid. This guy's the head of the Luther Wieler, head of the Robert Koch Institute in Germany. We're currently heading towards a serious emergency, direct quote. We're going to have really terrible Christmas if we don't take countermeasures now, as he anticipates the doubling rate of maybe every 2 weeks between now and Christmas. So Germany not on a good trajectory. Austria already bad. Lots of cases in Austria, 3 times the incidence of the UK in Austria at the moment. Hospitals in Salzburg and Upper Austria are overloaded already. Patients are being stored in body bags, which is never the most... But body bags are to ensure hygiene. It's not really the sort of considered dignified way we would treat dead people under normal circumstances. But this is what's happening at the moment because of the amount of people dying. And there's a lot of political anti-lockdown unrest in Austria as well. And then Belgium as well. We looked at Belgium on the graphics, tightened its restrictions, hoping to avoid a full lockdown. Prime Minister of Belgium, all the alarm signals are red for Belgium. It's looking bad for the next month or 2. Europe's map is quickly going red and we are the same. And booster doses starting soon. So Europe, or a lot of Europe, in for very high numbers of cases and hospitalisations over the next few months, I am afraid. Now, I was going to look at some detailed information from the UK now, but I think we'll go on and listen to Seamus from New Zealand now. So, update on vaccination and I believe the general situation in New Zealand from Seamus. Thank you, Seamus. Over to you.
Hi John, my name is Seamus. I'm from New Zealand. I'd just like to share with you my vaccination experience. So originally I was a little bit hesitant to get vaccinated. I was worried about some of the potential adverse effects, particularly the heart inflammation, the myocarditis. I'm young, I'm 25, I'm in that sort of risk group. I wanted to get vaccinated, but I was a little bit concerned. And I was wondering what might have been the cause for, such adverse effects. And then I came across your videos on aspiration, and I had a look at the papers that you cited, and I did some further research, and it seemed to me that accidental intravenous injection could really be the cause for it, or part of it. And so I felt better knowing that there's something I can do to reduce my risk. So I decided to get vaccinated. So I knew my local GP clinic that were offering vaccinations didn't aspirate, because I went with my mum, and I was with her in the room with the nurse who was giving her first injection, and we said to her, could you please aspirate the needle? And she said, no, I'm not going to do that. And we said, why? And she said, oh, it's against the recommended guidelines here at the clinic. So she didn't aspirate, and we kept sort of pushing her politely, and at the end she said, look, it's my choice on whether I want to aspirate or not, because I said, surely it's up to the patient. In this case, it was my mother. It's up to her whether she wants to have the injection aspirated. The nurse said, no, I can actually choose to refuse to vaccinate you, and I can choose not to aspirate. So we really didn't have any choice. My mum just got the jab. Thankfully, she's fine. She's fully vaccinated now. But I was a bit concerned by that. So eventually I decided to go and get my first vaccine. And I called up the clinic and I said, could you please aspirate? They said the same thing, no, it's against our guidelines. So I said, could I please talk to my doctor? So my doctor gave me a call, and I explained things to him. I said, look, I'm hesitant. I'm not going to get the vaccine if you don't aspirate. And he said, okay, I'll make an exception for you. And I was really, really happy. And he gave me, his argument. He said, look, Seamus, I don't think that aspirating is going to make any difference. The needle's so small. It's unlikely to hit a blood vessel, but I'll do it for you. And so I was really happy. I've got a great doctor, so I'm really glad he did that for me. I went in and got my first shot, and the nurse aspirated. She was a fully trained nurse. And by the way, on just backtracking, my mother's second shot, she had a trainee nurse. Apparently the nurse jabbed it in, sort of grabbed the skin and jabbed it. And, my mum was a bit worried after, because this trainee nurse sort of didn't seem to kind of do it properly, but thankfully she was all right. But so I had a fully trained nurse. She aspirated, no blood, and it went in fine. I felt a little bit weird the next day, but not really sick. And then the day after, I was fine. 2 days after, so it didn't really have any much side effects from the vaccine. Just a sore arm, which was good. I was glad I had a sore arm, because it shows that the vaccine's working. I didn't have any blood on my little plaster. I didn't have any metallic taste in my mouth, which was good, so I was confident it went into the muscle. And then just a few days ago, I got my second shot, and the nurse aspirated. I saw the same nurse again, and this time I asked her to hold it. I said, nurse, could you please just, when you pull back, could you just wait a few seconds? And she said, sure thing. And I said, I'm sorry if you think I'm being a bit weird. And she said, no, I'm just glad you're getting vaccinated. And she pulled back and she held it there. No blood, no pain whatsoever. Put the vaccine in, and I was fine. Next day I had a bit of a sore arm, still a little bit sore. Less side effects though in the second dose. Everybody says usually the second shot is we get more side effects. Where I found the first dose had more side effects. But I'm young and healthy. I exercise a lot, and I take lots of vitamins, vitamin D. I don't know if that helps, but yeah. So that's my vaccine story. But in general, they don't aspirate here in New Zealand. But at least in my case, it does seem like if you ask ahead of time with your doctor, they do it. But simply turning up to a vaccine appointment and ask them to get aspirated, they're probably not going to do it. In most cases, people could just walk in or go to a drive-thru and get a vaccination without booking. I booked mine, and so I was able to get that. So my advice for people is contact your doctor beforehand, and maybe just say you're a little bit hesitant, and they would probably do that for you. And just a quick update about New Zealand. So we've been in 3 months of lockdown, hence a very long lockdown here. Is probably doubled in length, but we're just coming out. We're just emerging to summertime here, which is good. So people getting outside, getting lots of vitamin D. A lot of people at the beach. But so we've just been in a hard lockdown, and restrictions are just easing a little bit, and probably another 3 weeks it's going to really open up, because we're trying to reach a 90% target of across all district health boards. It's like our regions, a 90% double vaccination. I live in Auckland city, which is the biggest city. It's about 1.5 million people, and I think the vaccination rate's here about 95% double jab, and that's with Pfizer. Recently they just started offering AstraZeneca, and also some recent developments for New Zealanders that we've approved Molnupiravir, but we don't have any yet, and the government has just finally ordered some monoclonal antibodies, Ronapreve, I believe, which is Regeneron, but I think we've only got about 5,000 doses, so just a small amount that's coming, which is good. So there's hope on the horizon for New Zealand. Do expect to see case numbers rise. New Zealand's been fortunate throughout this pandemic that we haven't really had to go through what the rest of the world experienced. But now the virus is here to stay. So it's likely we will expect to see case numbers rise. But with vaccinations so high, we're hoping that those high case numbers won't turn into hospitalizations or anything like that. But the problem with New Zealand, unlike a lot of other countries, is that our hospital capacity is very low. I think we have less than 1,000 ICU beds across the country. Some districts have just 10 ICU beds. So the hospital capacity relative to our population of about 5 million is very low. It's one of the lowest in the OECD. So that's why we've relied on hard lockdowns and high vaccination rates. My prediction is that New Zealand will probably be on track to reach 95% vaccination next year, which is quite a high target. So, and hopefully that will be good at controlling the spread. So that's just a little update from New Zealand. And thank you for your videos, John. I watch every single one of them. I love them. Keep it up. Thank you.
Thanks a lot, Seamus. Excellent.
Hi, John. My name is Seamus. I'm from New Zealand. I'd just like to share with you my vaccination experience.
There we go. Am I back on? Yeah, I'm back on. Okay, excellent report, Seamus. Thank you. And doesn't that tie in well with the UK report at the start of this video, where, of course, in the UK, they're not aspirating either? How many intravascular injections are given by mistake in the UK every day? How can we possibly know? It's all hidden inside the muscle. You don't see if the blood comes out or not. And it doesn't seem like it's going to change. It really is quite depressing. I mean, I've written to the Parliament, and lots of you have, and nothing's changed. Anyway, when you went to the doctor, doctors with your mum, Seamus, dear me, the nurse's choice. I think not. Your body, your choice. Your mother's body, your mother's choice. Good grief! How could any clinician say that? Basically, she seems to be saying, I have control over your body. Subjugate yourself to me and comply, or out you go. I mean, what? That is appalling. Appalling. Dear me. Patient's body, patient's choice. Mum's body, mum's choice. Don't let anyone tell you otherwise. Dear me. And there was actually a situation of confrontation with the nurse. They're not acceptable. She should have achieved, or he, I don't think you said, should have achieved concordance. We have to have concordance, not compliance. All clinical procedures should be carried out. All clinical procedures should be carried out in concordance between clinician and patient. And even your doctor did it for you, Seamus. I felt you were patronised a bit, to tell you the truth. Anyway, thanks for the report. Appreciate it. So difficult time for the last few months in New Zealand. Looking better. Monoclonal antibodies arriving, which is brilliant as long as they're given early. Remdesivir arriving. I am still waiting to see the safety data in a peer-reviewed report before I comment further on remdesivir. Am I getting my antivirals mixed up? It is remdesivir, isn't it? I'm thinking of molnupiravir, sorry. I can't remember which one you said now. I just scrubbed the last few minutes. The molnupiravir, I'm waiting for the safety data. The molnupiravir. I can't remember whether you said molnupiravir or remdesivir now, so apologies for that confusion. Let me be clear about what I've just said. For the molnupiravir, I'm waiting for the safety data before we make further adjudication on it. Anyway, on that point of clarity, thank you for watching.